Unfortunately, drug addiction is an issue that remains prevalent in pregnant women and parents all over the United States, although this is a more prevalent issue in urban minority settings. It is also 5.7 times more common in African American women than white women. Abuse of drugs frequently occurs in poor women with ages 25 to 34. It is also known that many people abusing one drug also mix it with other drugs. This is known as polydrug use and makes the situation much more dangerous.
Drug abuse affects the physical health of an individual and has lasting negative impacts on relationships, especially between family members. This is true for drug problems that occurred in the past or ones that are still an ongoing problem. When parents use and abuse drugs, it affects the dynamic of the family and has lasting effects on the children. Children who are exposed to an environment with drug use are much more likely to become dependent on drugs or alcohol than a child who was not raised by a parent suffering from substance use disorder. Children in this environment often become pseudo-adults and are forced to take on the role of caregiver and look after their parents or younger siblings, which can lead to intense emotional trauma. When a mother uses drugs while pregnant, it can cause a great deal of physical and neurological impairments and other health problems for the child, as well as lasting negative effects on the family unit as a whole.
Drug abuse of pregnant women has a huge effect on their babies. A study showed that these infants are 1.2 weeks younger, weighed 536 grams less, measured 2.6 centimeters shorter, and had a head circumference of 1.5 centimeters smaller than babies who had not been prenatally exposed to dangerous substances. Premature babies are extremely common with substance abuse. Babies also experience central and autonomic nervous system symptoms such as jitters, high-pitched crying, seizures, and irritability. These babies are more likely to have extended stays in the hospital. Sudden infant death syndrome is also very common among cocaine babies. They may have more exposure to disease and viruses as well. Drug addiction can affect children's neurodevelopment, behavior, emotional stability, and cognition learning skills over their entire lifetime. These infants are rarely breastfed and often taken away from their birth mother. Many grandparents will take their grandchild in. Negative effects on grandparents and current caretakers of the child include diabetes, arthritis, decreased health, psychological stress, and increased health risk behaviors.
Substance use disorder affects the individual, the family, and the town in which they are a part of. No person lives in isolation, and the actions of one individual can affect a whole community. The presence of drugs may take over parks, playgrounds, and other public spaces, which make them unsafe for community members, especially children. In areas with drug problems, there is often a much higher rate of crime and violence. The community dynamic may be placed at risk because drug users are more likely to be unemployed, living in poverty, and in and out of incarceration. The presence of drug use makes teenagers and young adults in this environment much more susceptible to substance use disorder. Parents with substance use disorder are more likely to be on disability or welfare because these addictions make it very difficult to get a job and remain employed. If pregnant women are addicted to drugs or alcohol, there is hope. These women can begin a drug detox that is safe for themselves and their unborn child. 2 drugs known as methadone and buprenorphine have been approved by the FDA to be used during pregnancy for women with substance use disorders that are trying to quit their addictions. These drugs fight opioid addictions while keeping the baby and the mother safe and healthy. The first step for a mother with substance use disorder is to seek help by reaching out to a hotline or other specialists, and there is no shame in doing so.
Many options available to people seeking for help are individual therapy, peer support groups, family counseling, medication-assisted treatment, experiential therapies, and case management. There are also resources to help people stay sober once they have started. They include medication management, transitioning housing to a sober living environment, participating in community support groups, 12-step programs, and participation in alumni groups. Another helpful tool is Narcotics and Cocaine Anonymous. It is a support system with the opportunity to connect with others facing similar challenges and experiences. Another option is cognitive behavioral therapy. Patients are taught to recognize their harmful thoughts and try to detect when they may relapse again. That way they can try to avoid it and develop some coping strategies. Do not be ashamed. Get help today.